That's what I was looking for. Will you tell my dad?
Honey, smile reveal. You gotta get
My
in
dad's
there.
timing is always so good. He always like runs the drill right when I'm ready to. Okay, so Deborah, this is a big moment for you. You get to see your new smile, and this is your awesome. And Lynn, we'll call you Lynn. Your hubby here. He's been here for all of our appointments too. I want to say thank you for being here.
Oh, absolutely.
I think.
Have a vested interest.
Okay, so, and we got everyone else here. Oh yeah, is Becky here?
She's on hold.
Okay. All right. Okay, so what we're gonna do is I'm gonna let you turn and show your husband first. Okay, and then I'll have you put the mask back on. Then I'll let you scoot forward and you can see yourself in the mirror. Okay, so go ahead and turn towards him.
So far, I like what I see.
She hasn't opened her mouth yet.
Oh, beautiful. Absolutely beautiful. How do they feel?
Really great. Yeah.
No, they look great. They look very, very good.
Okay, go ahead and put the mask back on. Now it's your turn.
Oh, she hasn't seen herself yet?
No.
You're the first one.
You're the lucky one.
Stand before me.
Oh, they look nice. Very nice.
Okay, you can go ahead and scoot up and go ahead and take a look. First.
Here, hold that for you.
This chair doesn't scoot. There we go.
There you go.
I mean, so you
What's
can't
this?
see the reflection.
No,
from that angle.
it's your picture. Jeez.
Just like,
Come on.
aw.
Come on. It's like a present. You're like, let me just rip it off. Okay, go ahead and take it out.
And can I look in the mirror?
Yes, you can.
I can. I gotta see around it. Oh,
They look fantastic.
they do. They do.
You look beautiful.
Well, I wouldn't go that far, but
I would go that far. Now you can take off that white thing if you want. You can see the smile.
oh, it's kind of scary, but a lot better than the before one.
Look how younger she is. Look.
Oh, she is.
When you said cheesy smile, you got one.
I have to say cheesy just to get you to do anything.
No,
So what do you think?
Yeah,
it's so good
just
to
smile
have
naturally.
tea.
Just smile naturally.
I don't know.
Look at that.
I love that. No, this is good. This is very, very good.
Best part is now you can start to chew and eat.
Yeah.
You guys gonna head to Texas Roadhouse or Chuckarama?
Yeah, I think we're going to be heading over to Texas Roadhouse here pretty quick.
That's where we had our first date. So
What's that?
that's where we had our first date.
Yep.
It
In
was
fact,
the
I
day
hope that we
before
can
we
get our
got
same
married.
booth.
But
Same booth, maybe.
maybe.
So she's good to go. I mean, she can chew and she
Yeah.
can chomp on anything. She
Like-
can gnaw off my fingers.
I say if it can't eat her, she should be able to eat it.
Okay.
So, no,
Well,
you're
lettuce. I haven't been able to eat lettuce.
yes. And so what I tell people is you will be able to eat lettuce. Now it's like anything. These are like a new pair of shoes, like getting in a new car. You just have to give yourself a little bit of practice time. Lettuce is one of the ones that's probably the most challenging,
Yeah.
but so you just have to practice. If you practice, you'll get it. Go ahead and smile nice and big so they can see it. Everyone's saying how beautiful they are. Look at that. Gorgeous.
Oh, fantastic.
But there's no restrictions. You can go right now and go find the biggest, hardest nut and go to town. Okay.
I'm going to get some nuts.
We get some nuts. Go to get a steak. What I tell people is just take the first couple meals slow because you haven't had teeth going back that far.
Yeah.
And so you want to give yourself a little bit of time to get your cheek out of the way so you don't bite it. Okay.
Okay.
What else do I say, Valentina? Like how I just put it
Call
on the
for
spot.
cleanings every 6 months.
Cleanings every 6 months. Even if you don't come back here and you can go to a hygienist that's a family friend or even
Just
closer.
somebody
We just
that can
want
take
someone
it-
that's
make it-
gonna,
You want to take them out?
not every time.
Not every time.
I like for her specifically, I mean, probably more than anyone, we don't want to take them out because it's very hard for her to get them in and out. So as long as she cleans them well, we just do a cleaning in the mouth. Okay. So, and I would say once every 2 to 3 years, we're probably gonna take them out just to see if there's something that,
Underneath or whatever.
but we'll usually see there's a couple so we'll look at an x-ray to see what it looks like in the x-ray. If the bone level looks good, that's awesome. That's one test. Second test is we'll take an instrument and just slide it underneath there, take some floss, and if we find that it's bleeding, then we know there's a little bit of inflammation too. We might take it off then also.
Can you put floss under those? Or?
Yes, and that's what I want. That's what I recommend is once a week. I'm kind of cheesy and I say it's like going to church. You got to take out the floss and floss once a week. That's all I ask. If you can just go once a week, you're in good standing. But the biggest reason is because if you start to bleed, then you know, hey, I need to do a little better with the water pick, or I need to get a cleaning sooner. That should be the indicator. Hey, you know what? There's something going on because inflammation is where there's more blood, right? And so when you slide something around it, it's going to cause it to bleed. It doesn't mean there's anything wrong. It just means there's a little bit of inflammation. So inflammation treated early, not a big deal. If you wait 2 or 3 years, now all of a sudden it could be a very big deal.
Okay.
It could be a very sad deal. We don't want that.
I can see her getting the floss on the outsides of the implants, but what about in the center part? Is that
Awesome question. So we have what's called a floss threader, and what it is it's like a little plastic piece. How would you describe it?
Needle.
It's like a needle in a sense, and we'll actually give you one, and you can pick them up at Walmart, Target, and you basically just you hook the floss around it, and then you thread it underneath the device. Right now it feels really tight, but the gums will relax, and you'll be able to push a little plastic piece underneath there, and then you go back and forth and you just clean it. And I know you didn't bring your water pick this last time, but
I brought it Monday.
I know,
And you
and then I didn't.
ignored it.
I know. I'm sorry.
But I mean, you
But
kinda
we're gonna
got
see you in a couple
gist
weeks.
of it. I mean,
But bring it back. I'm still committed to like showing you how to use that.
Oh.
And I do need to do a video. I've said this a million times. I just need an hour to sit down. But if you bring it with you, we'll check the bite, we'll fill the access holes, and we'll show you how to use your water pick.
Okay.
Okay. Other questions?
oh, that's cool.
In the first 6 months, I would say 1 out of 20 of my patients will have a screw. We're not talking the implant. We're talking the screw that connects your smile into the implant. That screw can come loose or just untighten. It's only because of the vibrations that could be a little asymmetric. So that's why I want to check you a little bit sooner than most. Usually I'll see that at 6 months with most patients, but with you I want to see you in like 2 to 3 weeks. Just a quick check. We'll fill up the holes. But in the first 6 months, if there was a device to get loose, usually it's then because you're grinding, you're clenching, you're also excited, you're chewing on lots of things. Apparently, you might be chewing on him. I don't know. but if that does happen, it's nothing I want you to worry about. That just means, hey, it means we're just working on the bite a little bit, and we tighten it back up, we adjust the bite, and then you're good to go. Okay. But it is an emergency in the sense that when the device starts to move, you don't call and say, when can you get me? And you call and say, I'm on my way in.
Okay.
And as long as Dr. Hendricks is alive, he is going to be seeing you. I mean, unless I'm like out of town, not there. But even in that case, I'd have one of my team members try to just tighten the screw up for you.
Or you don't fly us to your location.
I need another location, is what you're saying.
Wherever you are.
And I'm thinking Hawaii is really what I'm thinking. The rest of my team likes that idea too.
Becky's like, oh.
If there is a place that we have a second location, it'll be Hawaii first. That's
Yeah,
Maui.
yeah.
That's the place I love.
Yeah.
I have actually a couple patients, one from Maui and one from Kona, and so they really like that idea too. So
I can't blame them.
okay, so here's the floss threader. You can see that,
Oh yeah, yeah.
and like I said, you can pick that up at Walmart, Target, CVS. They're everywhere, but it's really simple. Use those. Some you can go on Amazon. They have lots of different styles too, and so let me know if there's one that works great for you.
Sparkling.
Yeah, right.
sparkles out.
But I do want to say thank you to my whole team because this is quite a big effort, and it's never just one person. Yeah, Valentina back there is a saint.
Fingers.
She's the one that you always choose. She's like, don't send Dr. Hendricks in here. his big, massive hands. I feel like I'm a giant when I work with you. It's like working like an operation. You know, the game with growing up, little operation. I feel like, and that's because you just have really, really sensitive skin, and that's one of the things that makes your case so unique, right?
Yeah.
So,
And a very small mouth.
yep. And the
And very small.
the people I love the most in this world have small mouths.
Yeah.
My mom has a very small mouth, and she makes it really hard.
Unintentionally. Anyway.
Any other questions?
No, I think. Thank you.
You're very, very welcome. Thank you for being patient. I know that you wanted these a month ago, maybe 2 months ago. I can't remember, but a lot sooner, maybe a year ago. But I tell everyone, I'm like, I'm working so hard to try to make everyone happy, and sometimes it's just impossible to make everyone happy. But I try. I promise you, I'm always trying, but I appreciate that you guys are so kind to.
And we've seen the effort.
So
We so appreciate everybody.
I'm honest enough to be like, I go live on these things because I want people to know, it's like, we're not perfect. We're always trying. Like, you know, there's going to be some mistakes we make every day, but we try to own them and we make them better. And
I thought you
so,
were perfect.
so.
Let's go.
Yeah, that's.
Yeah, we're done. We're done.
There's on back there. Good job on those teeth, man. Let's do one more close up here.
Yeah,
Let's see.
thank you.
Smile nice and big again. Wow, those are beautiful.